Hello everyone, welcome to Internal Medicine Theory. My name is Ali and today we'll talk about internal medicine. As a quick reminder before we start, don't forget to subscribe to our channel and to our other social media platforms. We post daily quizzes and cases. So without further ado, let's start with today's topic, and today's topic will be regional examination. So in regional examination, we divide to two parts, to the head and to the rest of the body. So let's continue. First of all, we need to identify specific facial appearance or expressions that can diagnose a certain disease from the first look. Yes, from the first look. For example, we have Parkinson's disease that has the mask face specific appearance. As you can see here, the mask face belonged to the greatest of all time, Muhammad Ali. Yes, he had Parkinson's disease. And Parkinson's disease, it's due to low dopamine level and mainly in substantia nigra. Okay, next. Caution disease or Caution syndrome has the moon face. As you can see, moon face with double chins. This is specific for Caution syndrome and Caution disease. So what is the difference between disease and syndrome? Syndrome are mainly the affected part is the suprarenal gland, which is lead to hypercortisolism. But in disease, we have the affected part is the pituitary gland, much more specific anterior pituitary gland, which is lead to increase the ATCH. So we have high cortisol. Okay, this is O. Next, let's talk about hyperthyroidism. It's the fair face. Fair face, it's exophthalmos. You can see his eyes are just popping out of the skull. This is in hyperthyroidism, or how it's called thyrotoxicosis. The pathophysiology, it's due to increased T3 and T4. Thyroid hormones. Next, we have myxedema or hypothyroidism. It's called the apathetic face. As you can see here, myxedema or hypothyroidism, it's mainly due to low T3 or T4. We call severe hypothyroidism myxedema is the end stage. Severe reduction in the amount of T3 T4 in the body. Next, we have myasthenia gravis look. It's called the fake smile plus ptosis. As you can see here, why we call this fake smile? Because the patient trying to smile hardly, but it not look normal. Myasthenia gravis, mostly due to low acetylcholine level. Okay, we need this for muscular contraction. Next, let's talk about acromegalic face, which is called giant face. As you can see here, giant face. And acromegaly, it's mainly due to increase of growth hormone. Okay. Next, we have the Down syndrome. It's called the mongoloid face. You can identify it directly. It's genetic predisposition. It's called the genetic trisomy. Next, also a common, it's the facial nerve damage. It's called facial palsy. As you can see here, due to the damage of the right side, we have loss of ability to contract here and to sustain a muscular contraction. We have a loss on the other side. Next, it's also common to see malar flush. As you can see here, this is a malar flush. Okay, in valvular heart disease, for example, in mitral valve stenosis. And please differentiate between malar flush due to valvular heart disease and the rush in systemic lupus erythematosus. Next, also it's common, it's called the it's called the buffiness of the face, as you can see here, and we can see this specific look in patient with nephrotic syndrome, in patient with polycystic kidney disease, an allergic reaction to a medication, to food, drinks, etc. Why we call buffiness, you can see the periorbital edema. Next thing to assess is the head. Assessment of the eyes, first of all, we will assess eyebrow and eyeball. We also assess the eyelids, sclera, cornea, pupil, conjunctiva, lens, all of them together to identify or to trying to notice any pathology. Next, we examine the nose and ear. Here we're looking for any abnormalities in the skin, structure, and the function. Skin, we look if there is redness, paleness, or cyanotic, or any other rashes. Structure, we look if it's large, small, and we ask the patient more question about it. The function, we ask the patient if there is any change hearing and smelling things. If you look and there is a discharge from the ear, suggest otitis media with further examination. Next, let's talk about the cheeks. In the cheeks, we will notice if there is pale, red, malar flush, or there is any brown pigmentation, pale in case of anemia, red in case of systemic lupus erythematosus, and Caution disease. Malar flush, it could be seen in mitral valve stenosis. Brown pigmentation can be seen in pellagra. As you can see here, we have a little bit of flush on the cheeks. The differential diagnosis for this patient could be a mitral valve stenosis, could be systemic lupus erythematosus, and could be any other dermatological conditions. Next point to evaluate is the lips. For the lips, we look for the skin, red, pale, cyanotic, and rashes. Next evaluation point is the structure. If it's large, if there is any angioedema, ask about any previous plastic surgery, or the presence of clusters of blisters. As you can see here, this condition called chiliosis. Chiliosis, it's due to infection that suggests herpes labialis, okay, or any other infections. There are specific infections that occurs specifically in the angular of the tongue. Next thing to assess is the teeth. If there is any discoloration, ask the patient of tobacco history, poor hygiene, and ask him much more about his occupation. If there is any possibility of lead contamination that led to lead poisoning. Losing of teeth, wide spacing that may suggest acromegaly, and notch. Okay, if there's any notch, suggests congenital syphilis, which is, as you can see here, those called the Hutchinson teeth. At the end, look for any dental caries, tooth extractions, and ask further about them. Next, we talk about tongue. We look for if there is any redness, paleness, cyanotic, or rashes. We look for structure, large or small. As you can see here in this picture, this patient has a little bit of atrophy here. Also here can notice atrophy can be due to lower motor neuron damage, can be to local damage. Next thing is the gum assessment. If there is any bleeding, suggest vitamin C deficiencies, thrombocytopenia, chronic liver diseases, and if there is a hypertrophy, suggest leukemia. As you can see in this picture, this is healthy gum, no bleeding, no change in the color, obvious normal structure. Last thing in the head to assess is the palate, tonsils, pharynx, and the breath. How to assess? To start with the color. Is there any inflammation signs, structure? If the high palate sign present, it's one of the signs of Marfan syndrome. Next to assess is the breath, acetone, ammoniacal. As you can see in this picture, this patient has tonsillitis. See? In large red deposition of white pus here suggests the infection. Next thing to evaluate is the neck. The neck, it's very easy to evaluate. First evaluation point, we look for any general change, which is called general examination. First of all, we look if there is any scars, lumps, rashes, hair loss, or other lesions. Next, we look for involuntary movement or edema, palpate to identify any area of tenderness or any areas of deformities that may suggest any other musculoskeletal diseases. Next, pulsation. We palpate the carotid arteries on both sides and we try to differentiate if there is any differences. Thyroid examination, it is very obvious to detect if there is any goiters, any displacement. Rigidity, we assess rigidity in case of meningeal irritation and cervical spondylitis. The patient may be irritated by the rigidity test. Next, we assess the trachea. We check the structure, mobility, and the presence of any mass by palpation. Sixth evaluation point is lymph node palpation. As you can see here in this picture, our patient has enlargement of the thyroid on the right side that may suggest a goiter and need further laboratory and ultrasonography examination. In this picture, it's so obvious, you can directly see that there is enlarged lymph node that may suggest lymphadenopathy or any other abnormalities. Let's talk about upper limb assessments. Upper limb, there is 6 evaluation points. First of all, we start with the color and the appearance. If there is enlargements in the skeletal measurements, if there is atrophy, fasciculation. Next, we assess the temperature, warm, cold, its huge differentials between hypothyroidism and hyperthyroidism. Patient with hypothyroidism, they tend morely to have cold skin. Patient with hyperthyroidism, due to hyperactive cellular metabolism, they tend to have more warm skin. Next, we check sweating. In case of increased sweating, that's a sign of thyrotoxicosis, toxemia. In case of decreased sweating, that's a sign of dehydration. Next, we assess the capillary refill by pressing and releasing the pressure out of the finger mostly, and the normal is 5 seconds to refill the blood back to the nail. Next is joint examination. For joint examination, we check if there is rigidity, if there is decreased range of motion, and lymph node, we assess them. If there is enlarged, we assess if there is enlarged or any change on one side or both sides. As you can see here, we have axillary lymph node enlargement. Let's talk about if presence of any specific signs, for example, edema, tremor, if it's rest or actional or intentional tremor. We ask about any other specific signs that are related to specific diseases, for example, ossular nodes, Genway, patches, and splinter hemorrhage. They are specific for infective endocarditis, as you can see here. In the first picture here, we have the Genway patches, and here you can see the ossular nodes. Both of these are very specific for infective endocarditis. Next, we check palmar erythema. Palmar erythema can be normal in pregnancy, can be in autoimmune reactions or autoimmune diseases. Also, it can be due to alcohol abuse. Lower limb evaluation points are 7. First one, it's edema. We check presence or absence of edema, if it's symmetrical or asymmetrical, the level, and if it's pitting or non-pitting. We check the cyanosis, if it's symmetrical or on one side. We check the clopping of the toys, the level of the clopping, the pellagra rush, the presence of the pellagra rush, severe deficiency of niacin or severe deficiency of vitamin B3 suggestions, as you can see here. Next, we talk about blood pressure differences between the upper and lower. In aortic regurgitation, on lower blood pressure is much more higher than the upper blood pressure, or how so-called Hill's signs. We assess the venous system, if presents deep venous thrombosis or thrombophlebitis signs, varicose veins. We assess if there is deformity, as in Marfan's, Duchenne, and other myopathies. You can see here the edema one side. You can see here cyanosis on one side also. And here you can see asymmetrical varicose veins. Next, let's talk about nail examination. Okay, in nail examination, we have 6 points to remember. First of all, color change. Is there any change? paler change, cyanosis, leukonychia, yellow, teary nails, or the presence of telangiectasis, such as in systemic lupus erythematosus. And we forgot to talk about teary nails, presence in cirrhosis, or in chronic renal failure. Also, we assess the capillary reperfusion, as we mentioned previously. Number 3, we check the spooning. Don't worry, next slide there is pictures that are going to demonstrate what are we talking about now. Splinter hemorrhage, also its presence, we said, in patients with infective endocarditis. Onycholiasis, differential diagnosis could be seen in psoriasis, could be seen in thyrotoxicosis, and fungal infection. Now, bands. What do we mean by bands? Bands are lines that are present on the nails. Okay? So 1, 2, and 3. We have B lines. They can be seen in malnutrition. We have Mies lines. They can be seen in chemotherapy and in renal failure. And we can see Yorkie lines, I hope I pronounced it correctly, that can be seen in hypoalbuminemia and in chemotherapy. Here's the pictures demonstrating for you. First one is spooning. You can see it's coved. Splinter hemorrhage, which is bleeding under the nail pad. P lines, as you can see them, mono lines, Mies lines. These lines can be seen in chemotherapy. You can see onycholiasis here. Onycholiasis described as the loss of nails. Teary nails, as we mentioned previously. Teary nails, there are white, severe paler nails. These could be seen in cirrhosis and in chronic renal failure. Next, let's talk about cloppings, clopping of fingers. We have 2 main evaluation points, grades of clopping, and if they are acute or chronic. First of all, grade. Second of all, if they are acute or chronic. Grade number 1, there is fluctuation and softening of the nail pit. Grade number 2, there is loss of hyponychial angle. Grade number 3, there is accentuated convexity of the nails. In grade number 4, we can see that the fingertip develops a clubbed appearance. And in grade number 5, we can see that the nail and the surrounding skin develops a glossy change with longitudinal striations of the nail. Let me show you a couple of pictures. Here you can see a clopping of the fingers. Clopping is mostly, you can see how it's changed. See, I'm going to show you another picture. This is grade 4 or 5, mostly 4 or 5. This one it's 2 or 3. Okay, you can see how they start to develop the round shape. Okay, besides of the normal, we can say this one, they develop this shape. The differential diagnosis of clopping fingers, the mnemonic is clopping, the same word, clopping. What do we mean by that? We mean by C, referred to cyanotic heart diseases or cystic fibrosis. The L, it's lung cancer. The U, it's ulcerative colitis. The B, it's bronchoectasis. And the I, it's for infective endocarditis. The N, it's for neurogenic tumors, neurocancers. And the last one, the G, which is for any GIT diseases in severe forms. Okay, next let's talk about assessment of edema. The main evaluation points are 5. First one is symmetrical or asymmetrical. Okay, so how that can help us in diagnosis writing. If we have symmetrical edema, that may involve systemic change, okay? It's not local change. What I mean by systemic change, I mean symmetrical can be seen in congestive heart failure, could be seen in liver cirrhosis, it could be seen in chronic renal failure, could be seen in nephrotic syndrome, okay, etc. So what I mean by systemic, it's that there is a condition that involves the deposition of the retention of the water to the body in general, okay? But when we're talking about asymmetrical is only one leg that is affected, as you can see here. This can be seen in patients with thrombophlebitis, cellulitis. Let me write it here. Thromboitis, cellulitis. Okay, next evaluation point, it's if it's pitting or non-pitting. Next evaluation point, it's the level of edema. If it's ankle, knee, or above. Okay, so next evaluation points we have is the grade 1, 2, 3, 4, and there is 0. What do we mean by saying 0? 0 is no pitting, okay? No matter how long we press, there is no pitting. It's gonna stay the same, okay? 1, there is plus 1 millimeter, okay? 1 to 2 millimeter. 2, it is 3 to 4 millimeter or much more. 4, 3, it is 6 millimeter depression. 4, it is 8 millimeter depression. It's gonna look like that, okay? This one, 8 millimeter, okay? And it's gonna take a long time to come back to the normal, okay? Or how so called the resolving time. This is everything for today's. Thank you very much for watching. See you next time.